I was not aware of it during my pregnancy.
There really is not a significant level of awareness.
Everything was unknown.
We don't know what his future is going to be like.
I don't think many people are talking about it.
My OB never discussed CMV with me.
I was one of those parents that had to diagnose myself.
Women have the right to know.
I don't know what will happen for my baby.
I wanted to tell myself that it couldn't be prevented.
This is a preventable disease.
This one is, for the most part, fairly preventable.
Is a word I didn't know, is a word none of my family or friends ever knew. Cytomegalovirus.
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 Cytomegalovirus, CMV.
Is a virus that is acquired by a pregnant woman and transferred then subsequently to her unborn child. And as a matter of fact, CMV is the leading viral cause of hearing loss in children. And statistics show that upwards of 80% of individuals by the time they're 40 years old will have experienced or been exposed to CMV at some point in their life. Cytomegalovirus, the way that it affects fetal growth is it attacks the development of the brain and the vital organs. There's a very broad range from absolutely no signs, symptoms, effect of the infection, all the way to, unfortunately, death, and almost everything and anything in between. And so Parker's brain had been impacted. Parker, fortunately, had that acute illness when he was born. However, Parker has global developmental delay. Parker has sensory integration challenges. Parker has cerebral palsy. Parker wears glasses. He did not walk until he was about 3 years old after extensive therapy, and we still undergo extensive therapy today. And the biggest thing that I want our communities, Oklahomans, providers, and anybody listening to this message is to know what your risks are of CMV, and that any pregnant woman has the potential of being exposed to the virus and acquiring the virus, then transferring that virus to her unborn child, especially if she is around other young children, ages 1 to 3.
At that 2-month appointment, we got our results back that it was cytomegalovirus. And there was basically, he just told me there was nothing they could do. He said, here's your diagnosis. We don't really know what her outcome's going to be. You're just gonna have to take your time and wait.
We were more worried about the outcome, if she was going to survive the pregnancy.
And at first we thought, a lot of times it doesn't affect your child, so it's okay. And then we read when it does affect your child, and it just tore our worlds apart.
By the time he was maybe like 10 months old, he wasn't meeting the milestones that she wanted him to meet. And we got an MRI. I remember that day. It was a very dreadful day when we got the phone call from her, and she said that it was abnormal.
She was diagnosed with epilepsy at 3 or 4 months old.
It was anemia, microcephaly.
But I have a mild case of cerebral palsy on my right side.
No, I mean, really, it's not minor that your child can't hear, but that's kind of where, as a CMV mommy that I now am, that's where our lives are. That's minor. If that's the worst case scenario, we are so happy.
Absolutely nothing compares when you see those moms losing their babies.
Speak with your provider. It's essential that you talk to your provider about your risk and to get more information.